Today we've been dispatched to a 40-year-old male with a nosebleed that won't stop. He's been compressing the fleshy part of his nose for approximately 15 minutes and we've got a cold pack on the back of his head. The patient's name is Craig and he has a history of recurrent nosebleeds in hot environments such as today. Sample, we find that he's got no allergies to medications, he takes no regular medication, and importantly he doesn't take any meds for hypertension nor is he on any anticoagulants. He has no past medical conditions other than these recurrent nosebleeds. His fluid and food intake is normal, as is his bladder and bowel function. The bleed is a continuous drip, which is venous in nature, and is not preceded by any nose surgery, skull injury or other trauma. My colleague has taken a full set of vitals and they're all within normal range. The patient is well perfused and systemically well. So let's just have a quick look, Craig. Let's take that down. So it's still bleeding. Just pop it back on. So what I'd like to do, Craig, is put some adrenaline in a syringe, squirt that up your nose, and it should constrict the blood vessels, and that should stop the bleed. Are you okay with me doing that?
Yeah.
Excellent. So I've prepared all my drugs and equipment. Got adrenaline and my saline, which has been drug checked for both myself and my colleague. I have a 10 ml syringe, a 3 ml syringe, a mucosal atomizer device, and a draw up needle. So first I'm going to draw up my 10 mils of saline to 9 mils. Place on my draw up needle. And draw up my adrenaline, which is 1 milligram in 1 mil. So we will have a total of 1 in 10,000. So I'm now going to pull back my 3 mil syringe to just beyond the 2 mil level to allow room to prime it. And fill this to the 2.2 limit. Just cover that for safety. Apply my MAD and prime. Okay, Craig, so I'm going to go 3, 2, 1. When I squirt this up your nostril, I'd like you to sniff as well. Okay, are you ready? And then cover it again. 3, 2, 1, goes and cover the fleshy part again. How are you feeling?
Okay.
Okay? Excellent. We'll just wait for a few moments. That should constrict all the blood vessels and stop the bleed very shortly, but we'll examine it very shortly. So we'll wait another few minutes and we now examine. Have a look, Craig. That appears to have really stopped. That's excellent, it's worked. So I see no reason why you can't stay at home today, but you need to avoid blowing your noses if you can, avoid hot showers and hot drinks.
Yep.
What I do need to see you do is just mobilise. So if you could just walk down there and back for me, that would be great. Yep, just come back and sit here. So what I'm going to do is give you a detailed plan of what we've done today and what you should do if either you have a reoccurrence of your nosebleed that's more severe or if you feel unwell. And if that happens, please feel free to call us back or consult your GP. I would then step away briefly with my colleague and run through the non-transport pause and checklist to ensure that it's safe to leave this patient at home.